genetics play a huge role in all of medicine and even in psychiatry. I did a podcast about 2 or 3 years ago. A friend of mine, Abdul Shabazz, had a podcast with WIBC on politics. But I was a psychiatrist, and I kept bugging him to let me on his show. So one day I kind of threatened him, I growled at him. I said, listen, you put me on your show. Actually, I said to him, here's what I said to him. I said, either quit telling me you're going to put me on your show, or put me on your show. And I kind of growled a little. And he said, how about Monday? I said, that'll be fine, Abdul, thank you. And I did a wonderful podcast. He was such a great interviewer. He'd had a few people on the show about opiate drug use, but he'd never had somebody with what I talked about. And he asked me, he said, do you see any role of genetics or something? I said, yeah, absolutely. So if you take a good family history when somebody has substance abuse, you will find 1, 2, or 3 generations of substance abuse. Grandpa was an alcoholic, grandma abused Valium, or somebody else overdosed, died of opiate overdose. I mean, it's just so clear. And he said, does anybody else believe that? I said, well, if you take these histories, you don't need anybody else's opinion. And so at the end of the interview, I did ask him, he did such a great interview. I said, Abdul, did you go to school and learn how to ask questions? She's really good at it.
Right.
But he titled the podcast, The Origins of Opiate Drug Abuse. So he was convinced that I was right. And that was not something he told me he was going to do. So genetics play a big role. I don't think it gets paid much attention. So there is risk. Theoretically, I think it's more of a risk than this, but they say if you have one parent that has bipolar, the offspring have 25% chance. If you have 2 parents, 50% chance. And one bipolar almost always marries another bipolar person. It's called associative mating. So there is significant risk. Now, if you had 5 kids, that doesn't mean 2.5 of them are going to get bipolar. One might get it,